strains of cannabis. There's many, many different other components in there. But why does one medicine, one plant, work so well as a medicine for sleep, but also for pain, and also for cancer, and also for epilepsy, and also for autism spectrum disorder, and also for anxiety? And this is because we have in our bodies something called the endocannabinoid system. And the endocannabinoid system is a natural physiological system in our body. It's been there since the dawn of time. It's in every single animal on the planet except insects. So even the sea cucumber has an endocannabinoid system. And what does the endocannabinoid system do? Very interesting, actually. On the way in here, I've been hearing this word adaptogenic. So I had a look on my phone, and adaptogenic is a word that refers to usually a herbal substance that helps reduce the stress in one's body. So adaptogens are plants that reduce stress. And what is stress? Stress can be anything from mental stress to pain, physical stress, inflammatory stress, physiological stress, so the release of cortisol and adrenaline in our bodies. And cannabis aims to reduce that stress, whatever it may be. But the amazing thing is that it can adapt, it can change depending on your requirements. And this is all done via the endocannabinoid system. So this endocannabinoid system is a system that controls all the other systems in our body. It controls temperature regulation. It controls digestion and gastrointestinal motility. It controls, very importantly, inflammation and immune response. So that's relevant in all disease and cancers. It controls the release of neurotransmitters in our brain and how we respond to things, our emotions and our emotional health. And the aim of this endocannabinoid system, it kind of works like an aircon thermostat. Whenever your body feels stress, this adaptogenic plant, this cannabis, can come in and help. So whenever you feel stress, the endocannabinoid system is turned on. And even without plant cannabis, our body produces its own cannabinoids inside us. So its own endocannabinoids. So in response to stress, sorry, got distracted. in response to stress, our body produces our own cannabinoids, and these are called endocannabinoids. The main one's called anandamide. The other one is 2-arachidonoglycerol, or 2-AG. And these, the endocannabinoid system has cells throughout our bodies and receptors throughout our bodies, located mainly in the brain and the spinal nerves and the spinal column are the CB1 receptors. So these are all to do with homeostasis, pain regulation, emotional regulation, and neuroregulation. And then we've also have cannabis 2 receptors. They're the two main types. There are many, many more. And these cannabis 2 receptors are located peripherally in our bodies. They are associated with immune response and inflammation. They're on all our white blood cells, and they're in our bone marrow and our spleen. So the reason this plant can work on all these diseases is through this system. And whenever our system has stress and needs to be brought back down to that smooth running temperature, that warm temperature in the middle, like our car should run just right with the radiator moving, but it gets too hot, we need to put more water through it and more air through it. Well, that regulation is controlled by the endocannabinoid system, but it does all systems. So if inflammation is one of your problems, then these cannabinoid receptors will be expressed on the inflammatory cells in the bone marrow, and they'll help regulate that inflammation. If pain is your thing, is your problem, then the endocannabinoid system will actually express receptors at the level of the spine to slow down the pain transmissions to your brain, to reduce the number. And it'll also be expressed in your brain and change the way you actually perceive pain. So with cannabis medicines, it's a funny thing. People will have severe pain and they'll come back to me and they'll say, look, doctor, my pain, look, I know it's there, but it doesn't worry me anymore. I can get on with it. So it doesn't get rid of your pain. It doesn't get rid of the source of your pain, but it changes how many pain impulses get to your brain and how you perceive those impulses when they get there. So it turns down that pain for you. And pain is obviously one of the main areas that medicinal cannabis is used for. So this endocannabinoid system is an amazing thing, and we all have one. And we all have a level of health of that endocannabinoid system. And it's there from the moment that the sperm and the egg in our mother join together and they start to divide. And even that cell division at that early stage of life in our bodies is directed and controlled by this endocannabinoid system. And then when you're born and you breastfeed from your mother, that mother's milk has amazingly high levels of endocannabinoids in it. And those endocannabinoids are very important, and they're passed over to you, and they help starting to regulate your immunity and help regulate your body and direct its growth further. And then as we grow, of course, the endocannabinoid system is a continual director of that growth, leader of that growth. So we have it in our bodies, and that's why it's so important. And that's why I can work on so many different things. And one big thing I'm sure you would have heard about here this weekend is whole plant medicine. And I am a very, very firm believer in whole plant medicine. So in the cannabis plant, there's over 144 different cannabinoids we've so far discovered. And there's probably a few more we haven't discovered. In fact, there was a cannabinoid I was reading about recently that's meant to be 20 times more potent than THC. And this is THCP, I think it was. So it's recently been discovered in the last couple of months. But it's always been there, obviously. And some researchers have isolated this and found that it binds to these cannabinoid receptors 10 to 20 times stronger than THC, the main component of cannabis. So there's THC and there's CBD. THC is the main component of the cannabis plant, and it's definitely the main component in terms of how much is in each plant. It's the bit that gives us that high effect that some people smoke recreationally for. THC is the molecule which we use as a medicine, and it's very potent, and it binds into those cannabinoid receptors I was talking about, like a lock and a key, and stimulates those receptors. And as I mentioned, it depends where those receptors are popping up in our bodies as to where that attention comes. So that's why we can treat so many diseases. Cannabidiol is the other main ingredient to the cannabis plant. It doesn't bind directly into those receptors. It binds on the side of your cannabis receptors and actually makes those receptors stronger at holding onto our own endocannabinoids that we produce naturally. So it doesn't actually stimulate directly those receptors. CBD does other things as well. It slows down the breakdown of our own endocannabinoids so that they stay in our body and in circulation longer. CBD is really an amazing part of the plant, but I don't think any of these components should be used individually, and that's why we always talk about whole plant medicine. So we can extract THC as a molecule. We can extract CBD as a molecule and have them as highly concentrated CBD pure or THC pure. But when we've done this and given it to people, given it to patients, and compared that to when we give them whole plant medicine, or where all the components of the plant are extracted and put into that medicine, we generally find that you require 4 to 5 times the dose of that isolated medicine to get the same effect as you would with the whole plant medicine. So besides THC and CBD, there's 144 other cannabinoids. There's over 600 different terpenes which may be in the cannabis plant, and there's a myriad of flavonoids and other active ingredients in the plant. So it's important that we use all of these molecules. They're grown in the plant. They're made in the plant. They go together and they work together. So they work together better than they do on their own, and we get a better therapeutic effect. And the terpenes are a very important element. So a terpene is the aromatic things that you'll smell in flowers, that you'll smell in fruits, that you'll smell in cannabis plants. And the very interesting thing I think about the cannabis plant is that it's collected terpenes. So the cannabis plant has co-evolved with us over millennia. We've been eating this plant. We've been eating its seeds. We've been making teas. We've been extracting the cannabis. We've been smoking the cannabis. We've been eating cannabis fresh. We've been using this medicine for millennia, and our bodies have developed with this medicine. And I find it very interesting that in the last 100 years-ish, since we've stopped this medicine and this food being so readily available, we seem to have a large rise in diseases of the first world, diseases of inflammation. And these are things that are normally controlled or regulated by cannabis medicines working with us. So I think it's a very, very important plant. And talking about the whole plant medicine, that's where we get our different types of medicines from in medicinal cannabis. So we talk about ratios, and the main ratio we talk about is the ratio between the THC in the plant and the CBD in the plant. A very common ratio is a 1:1 ratio, so equal parts THC and equal parts CBD. And this is a great versatile all-round medicine. It's great for pain, it's great for nausea and vomiting. And in fact, in my practice, I make it a point, a definite point, never to just prescribe THC. And I think this is one of the main differences between recreational or street cannabis and medicinal cannabis, is making sure that we have enough CBD in that ratio of medicine. Now, CBD is very important for reducing the high effect of cannabis, the anxiety of cannabis. So if you take a small amount of THC, it's likely to calm you down. But if you have a larger amount of THC with no associated CBD, you may get anxious, you may get anxiety, you may even get panic attacks. When we add the CBD in, it's actually a physical thing. The CBD binds just to the side of the THC receptor, the cannabinoid receptor, cannabis 1 receptors, and it kind of blocks out a little bit the binding of that THC. So the THC effect in terms of the high effect is reduced. Doesn't matter why, but it does. And I've noticed in my practice that some people that they for whatever reason have forgotten to take their CBD, or try to save some money and think, oh, I've got enough in that bottle, I've run out of my CBD, but I'll just wait till a couple of weeks when I see Dr. Tay and I'll get a new script and I'll get both bottles again. But I always warn them against that, and often they ring up saying, look, I'm having anxiety, I'm very nervous, what's happening? And I ask them a few questions like, oh, how are you going, what dose are you on? Oh, I'm taking this much and this much, and they're like, where's the CBD? Oh, well, I've run out and I didn't think it'd matter because I'm seeing you in 2 weeks' time, but I got really nervous. And that's a direct effect of having high-dose cannabis medicines, because people may be on high-dose THC medicines without having that associated CBD. So I think it's very important to have both those components in your medicine. Cannabis plants have been grown in the last Prohibition era, for the last 80 to 100 years, to have higher and higher levels of THC and not worry about the CBD, because the recreational market are people that want to get high. They want to have that high effect from the THC. So that's what's been selling. But now as we move into a more balanced and a more medicinal use of this herb again, we're finding that the strains or the chemovars, so if you have like red tomatoes, yellow tomatoes, tiger stripe tomatoes, purple tomatoes, there's thousands of different strains or chemovars of cannabis plants, and they all have their own specific ratio of THC to CBD to all their other cannabinoids and all their other terpenes. So one cannabis medicine may work very well for one person and not very well for the next. So we often have to swap between strains. In the legal market, that means swapping between companies usually. In the green market, it means finding someone else who's got bubblegum kush or different varieties of cannabis. And there are famous strains such as Charlotte's Web. So there's a little girl called Charlotte Figge from the United States who had severe epilepsy. And the main treatment for epilepsy in children with cannabis medicine is CBD in a ratio of 20 parts CBD is to 1 part THC. And so this high CBD medicine was made famous by this young girl, Charlotte Figge, who was having intractable epilepsy, and then her father started growing a high CBD crop of medicinal cannabis and found that all her seizures were alleviated, completely gone after treatment with this high CBD medication. So strain is very important, and making sure that those whole plant medicines are not only whole plant, but they're clean. They're clean from fungus, they're clean from fungicides, they're clean from excess nutrient used in their growth, they're clean from insecticides that may have been used, they're clean in the sense of no contamination that's going to harm your body because you're taking this as a medicine. And that is one of the good things, I must say, about the legal cannabis market, is that there's a form which all cannabis producers in Australia have to get from the government, and it's called a TGO 93. Doesn't matter, that's what it's called. It's a form that ensures that these medicines are clean. It ensures that these medicines are reproducible. So if I prescribe you a type of medicine, if I prescribe it again in 6 months' time or 2 months' time, it's going to have, within a small tolerance, the same stuff in it. It's going to have the same effect. And that can be a problem in the green market because of bushfires, because of variations in growing conditions. Medicines do vary slightly, and look, I know the medicines and I use the medicines in this community. I have patients that choose of their own volition to use compassionate or green market or locally sourced medicines, and I guide them in how to use those medicines and integrate them safely in their treatment regime. So that's cannabis medicine, and it works really well for us, and many things are helped with cannabis medicine. So I'll just run through a list of the things that I can think of that I've treated patients for. So anxiety, depression, autism spectrum disorder, insomnia, inflammatory bowel disease, rheumatoid arthritis, osteoarthritis, cancer, looking at a cure, and cancer alleviating the symptoms of chemotherapy-induced nausea and vomiting, radiation, psoriasis, all inflammatory diseases, long-term traumatic shoulder injuries, spinal degradation and neuropathy, sciatica pain, Raynaud's syndrome, which is a syndrome where you get cold fingertips and toes. Just about anything can be treated with medicinal cannabis when used correctly. So I know that you've probably heard a lot of information this weekend already, and you've probably heard about all these things, so I'll just touch on them briefly. But what I might do, if it works, is let people ask some questions to guide me in what you'd like to talk about, because I can talk about anything all day. Yes, up the back there. I'll give you this microphone if you like.
And Dr. T would repeat the question back so that we can all understand.
Hi.
Good morning. Afternoon.
I have a couple of questions.
So,
the first question I want to know is about drug interactions.
Okay.
Like with Keppra and blood thinners, warfarin.
Okay, very good question. So I'll repeat the question. So the question is, can you tell me a little bit more about drug interactions?
if you face the board.
So drug interactions with medicinal cannabis are rare, but they do occur. You can just flick the button down if you want. It won't squeal then. So we asked about drug interactions and medicinal cannabis, and this is something that I do go through with every one of my patients, and all my doctors are trained by me, and I make sure that they're educated in this area as well. So general drug interactions with medicinal cannabis. Things like painkillers, especially opiates, interact synergistically with medicinal cannabis. So there's a thing called the opioid sparing effect. And what that means is that when you have opiates in your body and you add THC to your body, Those two components will work together to give better pain relief than the opiates alone or the THC alone. So what this means on the ground is that we can often reduce opiate doses. So what I say to people is when we start their treatment is, if there's a medication that you take consistently, that you take every day, then keep taking those medications, whether that be Keppra, whether that be Tramadol, whether that be Endone, whether that be Panadeine Forte. Keep taking them as you normally take them. And we introduce the cannabis medicines and we slowly build them up, and we end up getting less and less pain. And as we reduce that pain, then we can start to reduce those cannabis medicines. So we use that drug interaction in a beneficial way to help remove drugs. And just on a side point, we have many patients that we remove completely from all their pharmaceutical medications. The majority of patients would get rid of at least half, and everyone gets rid of a couple. So it's an amazing interaction in a positive way. So alcohol, similarly, the effects of alcohol will be exaggerated by THC. So the effects of any depressive drug, so Stilnox or diazepam or oxazepam, any of the benzos or Valiums, they will be exaggerated too by THC, so we can often reduce the dose in those. And the other thing you're asking about is blood thinners, and that's a very, very good question. So in regards to blood thinners, in regards to just about every pharmaceutical medication that's made, the pharmaceutical companies utilise an enzyme in our livers, and that enzyme is called cytochrome P450. In fact, there's a few different cytochrome P450 enzymes. But those enzymes are utilised by the pharmaceutical companies to either activate medicines or to break down medicines. So THC is actually broken down by this enzyme, and CBD is broken down by this enzyme. But interestingly, there's a very interesting part, is that CBD in higher doses can slow down this enzyme, so slow down its ability to break down other pharmaceutical medications. So it's a really important thing which I check. And you mentioned blood thinners, and this is very important. So things like warfarin are broken down by this liver enzyme, and if we have high doses of CBD, our liver may not be able to quite as efficiently break down that warfarin. So we might find that our blood thinning effect can go up, and it can go up through the roof if you're taking high doses of CBD. So when I say high doses, I usually start to consider this at doses above 70 milligrams, so 70 to 100 milligrams a day. Saying that, that's more than most people require for CBD. Only really in cases of epilepsy and really bad anxiety would I even get to those sort of doses of CBD. But it is something to be very aware of, especially if you're in the cancer situation where you're using these green market medications to treat yourself for a cure. It's a very good idea to have some medical advice on that, because the doses that are recommended by people in this community and by myself when you're aiming for this cure of cancer often exceed those doses of CBD daily. So if you happen to have cancer and you happen to be on warfarin or Xarelto or any of these other blood thinners, then we have to be really careful that your level of the blood thinner doesn't go through the roof and you bleed accidentally into your brain or your lung, or have a hemorrhage or a stroke. So it is very relevant, and something that I make sure all my doctors address, and I personally address with every patient I talk to.
I have one more question.
No problem. Yeah.
I have to get back to work. So where is it? Yeah, breast cancer. So does THC increase the estrogen levels?
I'll repeat the question. Yeah. Yeah. So the question is what's the relationship between THC and estrogen-positive breast cancer?
Yeah.
So there is a tenuous correlation there. If you have an estrogen-positive breast cancer, there was a study which is performed with a small number of people that said perhaps there was a slight increase in the rate of growth of breast cancer when using higher ratios of THC to CBD. And it suggested that perhaps a 1 part THC to a 2 part CBD ratio would be the right ratio. I don't personally hold this one study in particular, as valid evidence for me not to to worry excessively about having too much THC. I often give breast cancer patients, or recommend that breast cancer patients take a balanced ratio and of CBD to THC, or if I feel it or they feel rather nervous or worried about it, they've heard something like this, then I'll do a 2:1 ratio, so have increased CBD. That often just adds a cost because I'll still be aiming to hit the same target of THC. It just means we're going to add a little bit more CBD on top. So that's not going to hurt you, but then the drug interactions do come into play. So we're boosting that CBD level. We've got to make sure that nothing else is going to be affected. Yeah.
Thank you.
No problem. Is there any other questions that anyone would like to answer?
The tingling in the fingers that you talked about, that Raynaud's or something, is that like the pseudo-gout, or is that?
No, Raynaud's is it's an inflammatory disease where you have vasoconstriction in the fingers and you get tingling and cold fingers and you can't get blood flow there. So cannabis medicines are useful in the fact that they're vasodilators. THC is a vasodilator. And helps the blood flow get back to those tissues and helps downregulate any inflammation in those areas. So making the blood vessels get bigger so the blood can get there. So regulating that blood flow, so keeping things in balance. It's that's how it works.
So pseudo-gout is a totally different thing then?
Yeah, pseudo-gout. I'm not actually that familiar with what you mean by pseudo-gout. I know what gout is. I suppose pseudo-gout, is that just pain in the hands for no reason? Yeah, pain responds really well, whether it's pseudo-gout sounds like something you don't know what the answer is. No one knows what the answer to is anyway. But there'll be definitely an inflammatory component and definitely the regulation of the endocannabinoid system there, and also reducing the pain from that pseudo-gout will be done at the level of the spine and the brain as well. Up the back there, blonde lady.
So you said that you can fill the prescription, any chemist can arrange that. Where's the product coming from? Is it onshore or is it imported?
Okay, yeah, good question. So at the moment in the legal market, the question was, where is the medicine coming from? It can be distributed through any chemist, not a problem, but where's it coming from? And it's a great question. At the moment, the majority of medications are coming from Canada and the Netherlands, because they're the two jurisdictions in the world where it's actually legal to export. It's actually legal to export from Australia as well, which is why we have a lot of interest in producers in this country coming to set up here. So the majority is imported from Canada and the Netherlands. There are one and almost two companies producing in Australia. So there's a company over in Western Australia, they were the first to market with Australian grown product. And they've got, I think, 3 products. They've got a balanced THC, a high THC and a high CBD product. And they're still getting on their feet, but they're doing well. There's another company up the Sunshine Coast which tell me they're about to start, they've already produced, but they're about to start distributing. But besides those 2, everything else is still imported. Yeah. Yes?
THC, CBD's effect on a patient fighting cancer with low blood pressure.
Yeah, so if you're looking at, treating yourself with cancer, the rough rule of thumb for cancer treatment is that we're looking somewhere between 250 and 500 milligrams per day of mixed cannabinoids. So if you look at the Rick Simpson's method, which is what everyone bases cancer treatments on, you're looking at about 1,000 milligrams per day of mixed cannabinoids. That means THC and CBD, that's what we're talking about there. So that's a lot. That's really, really, really a lot. That's like 15 to 20 joints a day. And when you're taking high doses like that, so put that in perspective, just a standard dose or a small joint, a standard efficacious dose for pain in the region of 15 milligrams. So when you're looking at somewhere like 150 milligrams of THC and 150 milligrams plus of CBD, that's a very, very large dose. And it's important that you do this carefully and you preferably under medical supervision and you slowly build up, because if you go too quick, we can have problems, side effects on these sort of doses, Cannabis is a powerful medicine and has a lot of effect on the body physiologically, and blood pressure is a very important area. So high doses of THC, they relax you. They relax your blood vessels. They slow down your heart, or they can increase your heart rate, but they relax your blood pressure by relaxing your blood vessels. So if you already have low blood pressure, so usually it's little old ladies have low blood pressure, or young ladies often have low blood pressure. If your blood pressure is already quite low and you take large doses of THC, then your blood vessels will loosen up and expand, and your blood pressure will drop, and you can get dizzy, you can faint, you can fall over. So whenever, and even just for standard doses, I say to my patients, look, when you hop up at night to go to the loo, take your time hopping out of bed, let your legs dangle over, maybe flick on the light because you could be wobbly. And especially in elderly people, I don't want them to fall over and hit their head or do a hip, because that can be the end of you if you're 95 years old. So yeah, do take care when taking any cannabis, especially THC in large volumes. And the way to avoid these problems is to slowly build up your dosing. You know, so what I do is I go up once a week. That's probably a little bit conservative. You could probably go up every 3 to 4 days, but once a week is a good amount. And depending on what you're looking for, so cancer, you're going to go up in larger steps, but still slow enough so you're not going to get these side effects. And also, there's many other side effects which you should consider on high dose therapy as well. So anxiety, paranoia and panic attacks, and mental health. So making sure you've got that balance of CBD in there is very important, and making sure that you take your time so you let your body tolerate to those medicines before stepping up each level, so that we don't have any negative side effects. Good. Over here with purple hair.
What do you suggest for a boy that's got autism, ADHD and ODD?
Good question. The question is, what do you suggest for a young boy? How old's a boy?
He'll be 15 in March.
So 15-year-old. So it does make a difference, young or older boys. So the standard treatment for ASD, autism spectrum disorder, which is a broad range of things really. It's a broad range of behavioural problems that group many different things.
He's a major handful.
Yeah.
And for that, it's,
Yep.
he's just been prescribed dexamphetamine,
Yep.
which has been withheld by his mother.
Yep.
But, you know, I'm
So-
really anti.
Yeah, so we're saying, you know, and a standard thing for ADD or ASD or hyperactivity, especially in those conditions, is to use dexamphetamines, which are literally, you know, pharmaceutical grade speed.
Yeah.
In younger children, these dexamphetamines seem to slow them down. Once you hit puberty, that's why I asked the age, how old is he? Yeah. Once you hit puberty, these dexamphetamines, they tend to just work like amphetamines. So you're giving an ADHD kid some more amphetamines, he's going to get worse. As a young kid, it often does work. What would you use in a cannabis medicine perspective? Well, I would definitely start with a whole plant, high CBD medication, okay? And the dose rate would be somewhere starting at 20 milligrams twice a day and moving up. And it's usually limited by cost. But somewhere in the region of 80 to 100 milligrams of CBD a day often works. I have had a boy in basically exactly the same situations. He came to me when he was 13. He's now 15, and hyperactive, ADHD. On the Ritalin, we started off with CBD medication. We got up to 100, 150 milligrams. Wasn't having any effect. Usually on younger kids, it will have an effect and change their behaviour. It doesn't always make them Rhodes Scholars, but makes their family life bearable for the rest of their family, and that's one of the main things. I think everyone suffers when you get one of these behaviourally excitable kids. And in that particular situation, and this is all through the legal pathway, I thought, well, I talked to the mother, I thought, I think we need to add in a balanced ratio medicine here. We need to increase the THC, okay? And I've got kids in the green market and in the legal market on THC-containing medications at doses which a lot of adults would flinch at or not be right for them. They tolerate them amazingly. So I started this young man off on a balanced 1:1 THC CBD oil, and slowly built up that dosing until he's at a dose of, I think it's about 10 milligrams twice a day of CBD and THC. So he's a minor. There's a little bit more effort on my behalf to get things through the government when you're trying to give THC to kids. But there's no rule that says you can't do it. You just have to have a good reason why, support that evidence, and usually have the kids' paediatrician or paediatric neurologist or whoever, you know, on board and say, yep, I think it's a good idea too. And then that can go through. And this boy came back in to see me just before Christmas, actually. And I hadn't seen him for about 6 months. And from a little shaky boy, very nervous, very agitated, jiggling his legs, scratching himself, you know, shy, not very good with girls, bullied a little bit at school. Well, he'd moved schools. He walked in, he was holding his head high, he was confident, he was happy. He got himself a job at the fish and chip shop. His school life had majorly improved. You know, he gained himself some friends at this new school, and life was rosy for this little man. And not one negative effect in any way. He's not dumber. He's doing better at school. He's getting better marks. He's still healthy. He's not smoking anything. You know, he doesn't see cannabis medicine as a toy. He doesn't feel the need to go out and smoke cones with his mates behind the football shed, because he respects this plant as a medicine now because it's made him better. So, yeah, generally it's a CBD medication for these kids, and then case to case, sometimes it's good to try THC as well.
So it would be worth going to speak to BBC?
Yeah, I mean, it depends on, like, obviously it depends on your own personal choice and point of view. What I would do is I would just try CBD first.
Right.
See how you go. And the thing with CBD is really important to remember, people, is that it's not like a pharmaceutical medication. It's not even like THC. Because CBD doesn't bind into the cleft of these receptors, what it does, it slowly increases the health, what I call the tone of your endocannabinoid system. So it increases your body's ability to make endocannabinoids, and it helps it keep those levels high in the body, and it does a lot of other little things too. So from that sense, you're supporting the body to do what it does naturally. And if that doesn't do the trick, because often when you talk about endocannabinoid tone, there's a thing called endocannabinoid deficiency syndrome, or endocannabinoid deficiency. So over time, our body's ability, like all machines, I suppose, they lose function. Like a solar panel, it loses the ability to store energy over time. Its rate of function lowers. And over time, due to antibiotics, pharmaceutical medications, pollution, stress, life, our body loses the ability to make enough of its own endocannabinoids. And when we can't make enough for our body, and that's personal to everyone, then we get symptoms of disease. And this manifests in people in usually, there's a doctor called Dr. Russo. Ethan Russo is the leading cannabis doctor in America. He's the one that made the drug, I can't remember anymore. Doesn't matter what it's called. And he's been involved in the industry for 30 years, okay, as a scientist creating pharmaceutical preparations of cannabinoids, and very knowledgeable man. And noticed that there was a group of things that sort of all associated with what he called endocannabinoid deficiencies. They were inflammatory diseases, they were migraine, they were inflammatory bowel disease, they were anorexia nervosa. This group of diseases, which are the diseases of the West, the diseases of the first world. And often when we address this deficiency by adding cannabinoids in externally and supporting our body with nutrition and supplementation to boost our levels of cannabinoids naturally, then those symptoms of disease would go away. Okay, so that's what we're trying to do. And when you're your ADHD boy, your endocannabinoid system is not quite on the game. So it can do a little bit of help, it can do a little bit of training, and get it back on the right path.
You were saying about CBD oil, but doesn't all cannabis have THC, whether it's low or not? And you're saying CBD, so you're not using the whole plant. If it has
When I say CBD oil, you can just put whole plant beside it. I don't prescribe anything that's not whole plant. So there may be a small amount of THC in that CBD oil. Yeah, usually there's less than 1% or 2%. It just depends, as I say, on the plant which it was derived from. Yeah. Okay, that's a good question. So we're asking about the acid form of THC and the acid form of CBD, CBDA and THCA. And all cannabinoids have an A and a non-A. And what that refers to is a thing called decarboxylation. So if you get the cannabis plant, and I know there was someone walking around before with little shots of cannabis juice. So that's going to be full of whatever was in that plant, be it CBD or THC or CBG and all the other bits. But they'll all be in the A form, so the acid form, the raw form. When you add heat to cannabis, to THC or CBD, the little A, the acid part, gets knocked off. And that changes the shape of the molecule and means it can fit into the cleft of your receptor. While the A is on there, THC is not going to directly stimulate your cannabinoid receptors like THC does after it's been heated up. So it doesn't matter how much cannabis juice you drink, you're not going to get a high effect from that medicine. That's not to say it hasn't got very good health properties. It still supports our body. It still provides anti-inflammatory effects and has been shown to be very, very good for inflammatory bowel disease and Crohn's disease, or those diseases where you have a lot of trouble with your guts and ulceration in there, and sometimes you have to get your whole bowel chopped out. And there's a lovely girl, Morgan, who's not here today, but she's a member of the cannabis community, I suppose, in Australia, and had severe Crohn's disease, not ulcerative colitis, she had Crohn's disease, and basically went down to the Australian Cannabis University, which is near here, and was juicing regularly fresh cannabis plants. So she was ingesting THCA and CBDA and CBGA and all the other raw forms of the cannabinoids, and had an amazing turnaround on her health. She was just about to have her whole bowel chopped out, and that didn't happen, you know, and her health has recovered, and that was something she did for a short term, but I know that she still does now use regular CBD and THC oils, but it's hard to get the plants to juice all the time, you know, and that's really the best way to get THCA. I know the Hemp Embassy does sell some THCA, and that's good, but really the best way to get it is just to simply juice the cannabis plant, and it does have a lot of health benefits, but it's not going to get you high. Yes?
Just in relation to who you're treated, how do you manage to obviously get the authority through the medical board of a team of neurologists in relation to a severe epileptic?
So you don't, if you're a severe epileptic patient, you can come to me, and as long as you're not a kid, and you've tried medicines before, you don't have to have the support of a neurologist, okay? I can get you that approval through the standard, it's called the SAS-B pathway. So it's just an online portal where we put in our reasons and upload a bit of information and get that approval back that makes it all legal. It's good if your other doctors are on board, but you have to remember that it's your body and it's your choice. And whatever a doctor tells you is only their opinion. And their opinion may not be the same as mine or yours. It's their opinion. And often doctors are very conservative. They're a very conservative bunch of people. They're very risk averse. They don't want to get in trouble for prescribing something they don't understand. And they don't understand cannabis generally. So you don't necessarily need their support. It's good to have. It's good so that we can follow up with them, and I would follow up with them regardless of whether they agree with it or not, because that's my responsibility to look after your health. Okay, so what happens is when you come and see someone at PlantMed, as soon as your medications are dispensed, a letter goes out to all your referring doctors saying, we're starting. 3 months' time, when we've got our result, I'll write a letter to all those referring doctors again saying, this is what we've achieved, this is what's happening, I think we should reduce these medications, and in particular with epilepsy, I do like to work with a neurologist to help reduce those medications, because I'm not an expert in the pharmaceutical components of epilepsy. I know what they are, I know the rough dosing, I don't prescribe them, in fact I try to reduce their doses. And I do that in conjunction with the doctor. So you don't need their support as an adult. It's your choice and it's your right to access medicinal cannabis. If you have got any disease, be it epilepsy, and you've taken medications, conventional pharmaceutical medications that aren't helping, that aren't fixing it, or aren't fixing it completely, or have side effects which you can't tolerate, cannabis medicine is a viable option for you.
What happens if the person's brain has been deteriorated that much, that obviously there's been damage from the epilepsy, which it does do, and that person can't say
Well, so the question was, what happens if the patient, because they've had so many seizures, and seizures stop oxygen getting to your brain, and you get slowly a little bit more brain damage every time, and eventually you can become incapacitated. But you're still having seizures, and you may not be able to communicate. In that case, you have a carer, and that carer is the person who makes those decisions on your behalf. That's what the carer is. So I've got plenty of patients that are non-verbal. Kids that are non-verbal, epileptic, have from birth have been like that, and I've got 32-year-old men in nappies, you know, and that's okay. That's okay. Yep. Have we taken one from you already?
Yes.
Oh, we'll ask another one. I'll come back.
Well, I'm a veteran, and I'm just wondering in regards to sort of like with legal cannabis use, because I'm highly illegal at the moment. What's in regards to your knowledge in working with veterans to being legal to get the cannabis?
So I don't understand your question.
Because I've got quite a few ranges of problems. I've got pretty severe PTSD. I've got chronic progressive multiple sclerosis.
Yep. And you're treating yourself on the green market? Yep, that's fine. And the question, the question is, you've got some ailments, PTSD, multiple sclerosis, you're treating yourself with green market or illicit cannabis.
That's the best thing I've ever come across.
And it's working, right? Yep. And the question is, how do you convert, or should you convert?
How and what avenue and where I can go to get it legally, because I'm getting nothing but closed doors.
Yeah, so yeah, that's a good question. So the question is, I'm treating myself with green market cannabis. It's working for me. How do I make myself legal? And why would you want to make yourself legal is another good question. One of the main reasons, I think, in your particular situation...
I've been faced down in court a couple of times using cannabis.
By the police? Yeah. So that's one of the main things in your situation, okay? If we lived in just a free, happy universe where no one else imposed their thoughts and rules on someone else, and everyone lived and let lived, and as long as you didn't hurt anyone else, that'd be great. I would say, why bother converting, okay? Because it's working for you. But we don't live in that world. We live in a world where we can get in trouble for taking our medicine. So it's important that you have this approval for the sense that you don't have to live in fear and worry all the time, okay? And so that's a reason. There's lots of other good reasons. Price is not a good reason. At the moment, the price is probably higher in the, well, I'd say it's probably at least double to 3 times depending on what medication. Saying that, legal medications of CBD are now approaching compassionate prices. So 11 cents per milligram is the cheapest CBD you'll get in the legal market, and it about matches what you pay for Endoca. So how would you convert? Come and see it. You can approach your doctor. Any doctor technically can do it. Most of them don't know how or have the time or inclination. So come and see Plant Med or a similar cannabis clinic or a cannabis supporting doctor. It's best if you can bring as much of your medical history with you as you can. So any notes, any scans, any reports. Preferably get a letter from your GP or your neurologist saying, Dr. Tay, can you please see this patient for treatment of their multiple sclerosis and PTSD with cannabinoids?
That's my next problem. None of my medical people are even opening that door for me.
So look, that is a problem. It's not a problem. I mean, it is a thing. A lot of doctors won't do it. They're just like, I don't believe in it. It's bad. It's going to send you crazy. You're going to die. I don't want anything to do with it. Okay, and they slam the door in your face. I've had people rip up our referral forms and chuck them at the patient, and I'm like, this is disgusting. So you can still come and see Plant Med. I have lots of patients like that, and I have a particular knack, I don't know, of getting this through for people. All we need is the supporting evidence that you're not lying, you know. So if you've got those scans that say, look, or reports say I'm suffering from PTSD, I've got MS, and these are my symptoms, and I've tried these meds. It's important for the application that you've tried some medications, even in the past, even if you don't take it anymore. I'll put them down on your application, and then you still fulfil the requirements, okay? And then sometimes the government will then say, well, we need a letter from the neurologist. And I said, well, the neurologist is not supportive. I can't get you that letter. And then it goes through. So you can still be converted. It's still your right. You still fit in the requirements. Just because another doctor won't give you a letter, they're coming round slowly but surely. But yeah, you can just call up and make an appointment. We can work these things out. Yes.
Just as a general comment, I have to say that access in the legal prescription, medical cannabis, the THC, the CBD was a straightforward process. And I did like there was a chain of custody from organic supply, from birth to, growth to dispensing. It's good quality. I wouldn't be deterred by the slightly extra price you pay if you got a bit of money.
Yeah, if like it does cost a little bit more, those prices, they're going to equalise. And I know Michael knows this, and I know this, and everyone who's got any idea knows this. The prices are coming towards each other. The green market price isn't going up, it's staying the same, but the legal price is coming down, and they will come to parity, and then it will just be a choice.
It wasn't that more expensive and, legal.
Yeah, so...
And you know exactly what you get, quality control.
Yeah, so the quality, I mean, the products in Nimbin are good. Not all through Australia are they good. They've done studies where they got a sample of all these different epileptic kids' medications, their oils. They said to their parents, can you send them in, we'll test them. And they tested them all, and they're all meant to be high CBD. Only one of them was high CBD, what it says in the bottle. Some of them were high in THC, some of them were just olive oil. So that is one of the advantages of this legal market is we do know the percentages and things that are in those medicines, and they stay the same. Yeah.
When do you think it's going to be subsidised, like on a prescription script, because just because it's got parity with the green market right now?
Still expensive, yeah.
It's still so expensive.
Yeah, so to get things subsidised by the government, they have to be on what's called the ARTG, the Australian Register of Therapeutic Goods. That takes basically a lot of money from the people who want to get that medication on. So there's one medication which is on there, but it's still not subsidised. So it can get on there and still not be subsidised, obviously. There's one medication which is, and that's the Sativex medication, which is still very, very expensive and it's not subsidised at all. So it's a legal thing. It's a money thing, and it's the producers wanting or having the ability to get it through, and that getting it through means running studies in a very stringent way and complying with all the rules and complying with all the rules of any standard pharmaceutical medication. So the same way that endone or any other medication has to go through the system of government, that's how cannabis medicine can get on there, and it can, and it will, as people put the time and effort into getting it there. In terms of how long's a piece of string? Yes.
How do you broach this with your oncologist, say, when you've gone through chemo and you're in a second round and one thing and another, and the oncologist is sort of the pamphlets are in the office, but how do you just broach it with him straight?
Yeah, so the question was, you got cancer, if you got cancer, you've usually got an oncologist and they're going to offer you chemotherapy agents. And how do you broach that you want to try medicinal cannabis with them? And also often, after this happens all the time as well, after